Jen, thank you so much for being with us here at the Power Plus Summit. We're so excited to talk to you today about how we accelerate women's power and influence and learn a little bit more about your work and the work of the Gender Policy Council. So this is your third administration and second White House experience. Can you tell us a little bit about your journey and how you arrived at this work in this moment?
So I am a lawyer by training, and I went to law school thinking that I was going to have a career in health policy. So when the Clintons got elected in 1993, all I wanted to do was move to Washington to work on national health care reform, and I managed to do that, thinking that I was going to work in D.C. for 6 to 9 months, pass national health care reform, hubris, right? And then move back to New York, which is where I'm from, and live happily ever after and figure out what a career in health policy looked like. I worked on the famous healthcare reform task force, and then when healthcare reform failed, I got what remains to this day a mysterious phone call from Maggie Williams, who was the then First Lady's chief of staff, who is still a friend, mentor. I idolize her. And all she said was, the First Lady would like to know if you would want to work for her. And I remember so clearly taking the phone away from my face and my mouth because I was breathing so hard I thought I would embarrass myself, caught my breath, put the phone back, and said yes, knowing nothing about what the job was, which was the Special Assistant to the President for Domestic Policy and her domestic policy advisor. And the reason I say the title is because what was truly fortuitous about it was that there had never been a policy advisor in the office of the First Lady, so they had to borrow a slot from the Domestic Policy Council. And what ended up happening was that my job really crossed both the Domestic Policy Council and the First Lady's office. And I continued to work on healthcare, on the formation of the Children's Health Insurance Program, still something that I'm super proud of being a small part of, and a range of other health issues, women's reproductive health and rights, etc. And then fast forward, and there was a period of time, as you and I have discussed before, where I had little kids and I was sort of balancing work and family a little bit more than is possible in the White House. And then when Secretary Clinton became Secretary of State, she asked if I would come to the State Department to work in the Office of Global Women's Issues with my other mentor and longtime friend, Milan Verveer, who was the first ambassador at large for global women's issues. And I worked on global health and girls' education and really the very nitty-gritty work of trying to figure out how you integrate gender equity and gender equality into the work of the State Department. And so that's sort of what gave me the tools to take the job I have today, which is, the Gender Policy Council is a policy council that crosses both domestic and global issues.
Two things that came up for me when you were talking. The first I want to talk about is this, taking a hard loss. So you talked about the healthcare reform and that being a loss, but then keeping going in the work and pivoting and also staying focused on the issues at hand. What should we be thinking about in terms of keeping moving and keeping our eyes on, the larger project of gender equality?
I do think that if you sign up to do this work, you have to sign up for those setbacks and also the moments of progress and sort of trying to see your way around the corner to figure out how to make progress, as you just said, in this incredibly difficult time. So, to take the healthcare example, I really took my my guide from her, which, is one of the reasons I have admired Hillary Clinton for this long. She didn't take but a minute to focus on that loss. And I remember so clearly, she called a small group of us together, literally to think about what we could get done. Her first question to all of us was, what can we do? First of all, that will help some people. And second of all, that will lay the groundwork for this in the future.
For many of us at the summit, and we've seen it during the pandemic, women had a really hard time juggling work, childcare responsibilities, caretaking demands. Could you talk a little bit about that, how you've done it, what advice you would give to young women who are starting out but also struggling with, wanting to step into their career in a full way, and also their family demands?
First, just as a matter of policy, you're exactly right to point out that I think care and quite frankly, the lack of care and the lack of care infrastructure in this country is the reason that, there have been these imbalances, because women are bearing more of the responsibility for care at home. In my own life, I, left, as I said, when I was 34, and left the job in the First Lady's office. I literally, at my going away party, said it's hard to leave the best job you'll ever have at the age of 34. I was about to have 2 kids. And I say all the time, these White House jobs, even more so than, other places in the administration, but, so many jobs your own are very, very demanding. And you have to be ready for it, and you have to be, wanting that at that point in your life. But my advice is, if you think you are, needing to step out of a high pressure job, but you think that you will want to come back, there's so many ways to stay involved, to do good, and to keep yourself involved, and then your time will come around again.
I had my twins, and after a while, when they're about 4 or 5, I had to change my career so that I had more flexibility. And at the time, I was doing the work that I believe I was called to do. And so when I think about women writ large, I think about the constrained choices that many of us have to make because of the burden of care, and women are expected to off-ramp their careers. But also here to say, we're both sitting here right now, back on track in our careers, but wanting to think through the larger structures and working to ensure that they work for working women and mothers in a way that perhaps they didn't for us in some instances.
And, you and I are both fortunate that we had jobs that you could step away and sort of maintain a hand in. And for many women, including those, care providers that we were just talking about, that's not an option.
I want to talk about power a tiny bit. So you've been in some incredible decision-making roles. We just heard about it. As a woman, as a leader, a professor, a public servant, what have you learned about power and how it operates in your career?
Yeah, I think about power as a very broad concept. So I don't think about power as leadership. I don't think about power as only for those at the top, men or women. I think about, power to make your own choices and power to create your own opportunities, and sort of what we need to do as a society, and in my current position as a government, to ensure that we address that power imbalance, because the power imbalance has many effects, whether that's, the power imbalance that causes sexual harassment at work, the power imbalance that prevents women from making their own reproductive health choices, right? There are real implications in everybody's life. So I think about power as something that's very personal, and that we have to ensure that people, in whatever circumstance they are born into, or whatever circumstance they want to be in, that they can have power and exercise it. And that's sort of really the guiding principle that has driven my work in, really throughout my career.
So I want to switch gears a little bit and talk to you a little bit about your work at the Gender Policy Council. Can you tell us a little bit how you all arrived at the 10 interconnected priorities outlined in the strategy, and why do you think in this moment it was really important to articulate a national and in global gender policy strategy for the White House?
What I learned during my work at the State Department, as I said, integrating gender throughout the work of the department, was those documents matter. Rather than, there's a section or a section of a section on gender equality, it was embedded throughout. And so that became the blueprint. And, it's the first time ever in the United States we've had a national gender strategy. There's a couple of things about it that are significant. The first is that we laid out a set of principles, and those principles really undergird the entire strategy. And, the first and most important is, you've taught me, is that the work needs to be intersectional. So if you're thinking about gender equity and gender equality, you need to be thinking about a lot of other ways that discrimination and bias affect people. And, the obvious is race, but it's far beyond race. It's socioeconomic, it's disability, it's immigration status, it's ethnicity. And so when you think about, first of all, what issues have an effect on gender equity and gender equality, and how they have to not only are is equity intersectional, but the issues have to be intersectional and connected to each other. So if you want to actually help somebody improve their economic status and gain economic security, you need to ensure that they have the health care they need. You need to ensure that they are living a life free of violence.
And it's a really brilliant document because it does do a good job of connecting the dots and showing how, the violence that women experience in their lives impacts their economic security, can also impact their reproductive health. And the other thing I want to lift up about the strategy document was that the creation was very thoughtful. You engage leaders from across the country, both national and local, and got their input in developing the strategy. How did you all think about that when you were pulling together the strategy document?
Yeah, so it was sort of two things. One is taking in from external stakeholders, and second of all was listening to others around the government. And one of the other things that is built into this strategy and the implementation of it is that every cabinet secretary and agency head is a formal member of the Gender Policy Council, and they have all appointed senior designees. Those senior designees were integrally involved in building the strategy, and now, of course, they're integrally involved in implementing it. So what we're doing right now is waiting anxiously for the next 2 weeks for all of the different agencies and departments to come forward with their priorities under the umbrella of this strategy.
Women bore a disproportionate number of job and income losses during the pandemic. And why is the Gender Policy Council's work so important in this moment?
There's a range of issues that we need to keep working on to ensure economic security and to ensure that people are able to not only in this moment but over the course of their careers can support their families, can support themselves, and eliminate what you've studied, which is that wealth gap in addition to the pay gap.
The pandemic revealed that the systems weren't working for many women and families. And so I just see this moment as an opportunity to get it right, to create policies at both the state and local level and federal level that will work to ensure women's economic security, that they have access to paid sick and family leave, health insurance, health care, and are free from violence in their lives and in their communities. So, I think in this moment we do have an opportunity to really double down and make progress on some of these issues.
I wake up every day it's a strange way to say it, but worried that we are going to lose the opportunity to make progress on care. And that really has to remain a priority because, what we have seen is so obvious, right? We're suffering in this country because we don't have sufficient paid sick days, because we don't have a national paid family and medical leave program, because we don't have adequate, quality child care for people and elder care. So those have to remain priorities, and they do, obviously, in the Gender Policy Council and the Biden-Harris administration, but we have to make progress.
The Power Plus Summit is focused on big ideas for accelerating women's power and influence in society and in this country. So, and we've been talking a lot about moonshots. If there were no barriers could happen, or we could achieve, what would be your moonshot?
I think the real full answer is what you're doing here today, which is focusing on addressing that power imbalance. So care is part of that. Pay is part of that. Health choices is part of that, ensuring that, the right to abortion, which is, we haven't talked about, but is under severe threat right now in this country, ensuring that, people have power and agency in their own lives.
I want to thank you so much for being with us this afternoon and sharing your time, your ideas. You are brilliant. I just want to thank you so much, and thank you for joining us.
No, thank you. Thank you for having the summit, and thank you for the work that you do every day before and after.